How do you treat heel fissures that are cracks in the back of your heel that can be painful, that can snag on your socks? That's what we're going to go over in this episode of Healthy Living. You can see here, this is an example of a heel fissure. Okay, what a fissure means, it's kind of like a deep crack or a deep crevice. And one of the most common places that this happens is in the back of the heel. You can see this example, there is these deep cracks that are in there, and then there's this callus that's kind of covering it. And this is a problem that females, I would say 90% are females. They have this problem in the summertime, some have it in the wintertime, but the majority of patients have it, and they kind of deal with it and they get concerned. So I guess the first question is, how long have you had the symptoms? If it's something that you haven't had that long, it might go away on its own. But if it's something that you notice every winter or every summer, you should probably get it checked out. And what treatments have you tried? What are the things that have helped in the past? I always ask these questions to all my patients before I see them. And then how does it impact your life? If this wasn't impacting you, you know what? You probably wouldn't be watching this video. So it's frustrating to you. It's embarrassing. You want to kind of know what you can do. And there's a lot of other kind of misconceptions and things like that that people say that you can do. I'm going to tell you what really works. I see this every single day in practice with my patients. And then why do you want treatment now? That's kind of the thing. And really the treatments aren't that complex, but you just have to do them. So I'm going to explain them. And one tip, when you're trying to do new treatments, okay, make sure that you make it a habit. And this is something that's key. So you want to do something called habit stacking. So you take something that you already do. Let's say you take a multivitamin every morning. That's when you're going to do these things that I'm talking about, if it relates to like buffing it or pumicing it or putting a cream on it. So let's get into it and look specifically what a heel fissure is. So a heel fissure, you can see this image on the top, it's a crack that's in the back of the heel. It tends to happen in the back of the heel, but if this gets really big, it could actually create a cut. It could create an ulcer or a wound. Some patients even have ulcers in this area if they're diabetic. So it can be very dangerous. Now, if it's not treated, okay, it can be painful when you're standing and walking. It can cause bleeding. Like I said before, it can snag on your sock, which is more of a pain than it is, anything else. And you can be at a risk of developing an infection or a wound if you are a diabetic. So that is a big concern. You want to be careful. Now, I use this dysfunction symptom index to help explain things for a lot of things that I do. So you can see on the bottom, I have the age. So as you get older, you can go over this symptom line and you have to look at, well, what is the dysfunction? Well, I know, heel fissures, this is a very simple thing. What's the dysfunction that can happen? Well, you could have a dysfunction of the type of shoe you're wearing. It could be an open back shoe. You could have dryness. You could go barefoot. You could have diabetes. What's the problem with diabetes? Well, with diabetes, you can have something called autonomic neuropathy. So basically, your sweat glands don't sweat as much, and that could cause a crack or something else like that. You could also have a skin dermatitis, eczema, inflammation of the skin that could cause it. If you're standing for longer periods of time, also that can cause it. And then if you use some type of a harsh soap, what do I mean by a harsh soap? A soap that really, really dries out the back of your heel. That's also something that can happen. So what happens is with patients, if you go over the symptom line, you get the cracks, you do treatment, it goes under the symptom line, and then it may go over the symptom line. Basically, you have to do these things probably the rest of your life.